Hi, this is Dr. Jared Garris. I'm the Glenn County Health Officer, and I'm going to go ahead and go through the training for church employees and volunteers with COVID-19 and reopening. So just to kind of give a little bit of a background story is COVID-19 and churches have not mixed very well in the past. And if you go ahead and Google it and do a search, you'll find that throughout our country, many of the communities, our largest outbreaks have been related to churches, and even globally. For instance, in the state of Washington, there was a 60-person choir. They had a 1-hour-long practice. 45 people became infected. There was 3 hospitalizations and 2 deaths. So a lot of people contracted COVID-19 from a one-hour choir practice. In our area, there's a church in Sacramento that had 71 people who contracted COVID-19, and there were multiple deaths that were associated with that. In Redding, there was a church that had 6 people who contracted COVID-19, and there was at least 1 death that was associated with that. At the time, they only had 23 cases, so a quarter of the cases was linked to one church. So why is that? Well, I think a big part of that has to do with the way that COVID-19 is spread. And COVID-19 is spread by respiratory droplets. So we have these little tiny particles that go out into the atmosphere when we cough, when we sneeze, or when we speak. And in fact, the louder we speak, the farther out those respiratory droplets go. And so singing really sends those respiratory droplets out there, okay? So the other thing that goes along with that, so the farther, more distance that we can have, the less likely that we are to inhale those particles or for them to get into our eyes. And once again, that's hands down the most common way that COVID-19 is spread. So if we can put more distance, the less likely we are to contract COVID-19. The other thing is if we can limit the amount of time that we're in close contact, that can greatly decrease the spread of COVID-19. And then infectivity. So obviously you have to have somebody with COVID-19 to be able to spread COVID-19. Now, in general, the sicker you are, the more likely you are to have those respiratory droplets full of that coronavirus, okay? So these are the things that really go into making somebody sick. And CFU stands for colony forming unit, and it's kind of a microbiology term that we use. There's a certain amount that we have to get to be able to make it so somebody gets sick, okay? And these are the things that are really going to go into determining who gets sick. Okay, so I love this picture. It's from the CDC, and this is a gentleman who is coughing, and you can see all those respiratory particles just going out into the atmosphere, and you can totally see how they can travel more than 6 feet. Okay, so in Glenn County, as of June 1st, we have a total of 17 cases of COVID-19. We've had 13 of those cases. We know exactly where they got it. So, and there was 2 parts to that. One was that we had prolonged contact, so more than 15 minutes, in close proximity, less than 6 feet. Okay, so these aren't brief interactions. This isn't going to the store and getting something at the grocery market. This is from sitting down and having a long conversation with somebody. And this is when COVID-19 is spread, okay? There's one that we're not sure where they got, which isn't a surprise. We know that somewhere between 25 and 35% of the people who contract COVID-19 aren't going to have any symptoms at all. And so we expect to have somewhere we don't know where they got it, okay? There's 3 of those cases that we're still presently investigating as to where they got it. Of those 17 people who've developed COVID-19 in our county, there's 5 of them that have required hospitalization. So they were sick enough that they needed to be put in the hospital. 2 of them need to be put in the intensive care unit, and 1 of them required a ventilator. Of those 2 that ended up in the intensive care unit, 1 was in their 30s and 1 was in their 60s. So not real old, okay? So that just kind of gives a little bit of a snapshot of where we are at our county, and it kind of gives us an idea that, gee, when people get COVID-19, sometimes they get really sick. Okay, so who is at greatest risk with COVID-19? And clearly it's the elderly. And we say that if somebody is older than 80 years old, then there's a 15% chance of dying. And the more medical problems, the more likely people are to have serious complications. And so in the nursing home, which tends to be the elderly and those that are more frail health, we say that if somebody contracts COVID-19 in a nursing home, there's about a 25 to 30% chance that they will die from it. So it really is hard on the elderly and the frail. In general, we say that 80% of people with COVID-19 are going to have mild or no symptoms. And when we say mild, we mean that they're probably not going to be severe enough to require hospitalization. And 25 and maybe even 35% of the people will absolutely have no symptoms at all, which unfortunately makes it very difficult to try and quarantine and isolate when we have people walking around with no symptoms who can spread COVID-19, which is unfortunately what we have. So I'm a big fan of the 80-20 rule. I think that it's very important that we put our energy and effort into the areas that it's going to make the biggest difference, okay? And that with COVID-19 in churches is going to be focusing on handling those respiratory droplets first and foremost. So that's the far and away the most common way that COVID-19 is spread. And if we can focus on that and make it so that that doesn't happen, then our chance of spread goes way, way down and churches become much safer. So these are the things that I think are going to make a difference. If we can keep people separated by 6 feet and we can keep interactions brief, that makes a big difference. If we can say no singing, okay, and I know that's a tough one, but it just makes it so those respiratory droplets do not happen nearly as much. And then wearing a mask. And what masks do is they protect everyone else, okay? So when we, if we're wearing a cloth mask and we snot and we cough, we sneeze, instead of it going into the atmosphere around us, it's just contained right there for the most part, okay? And if you want to kind of get an idea as to the difference that it makes, go ahead and put on a cloth mask and blow and feel how much you can feel on your hand and then take it off. There's just no question that it decreases the amount of our respiratory particles that are leaving our lungs out into the environment, okay? And then to keep sick people from coming, and we'll kind of go over those things and more. So here are the symptoms of COVID-19. So we got fever, cough, shortness of breath, chills, repeated shaking of chills, fatigue, muscle pain, headaches, sore throat, new loss of taste and smell, diarrhea, nausea and vomiting, nasal congestion, runny nose. And if we have these symptoms, we need to stay home, okay? We need to keep from spreading. We want to love our neighbor enough not to bring it to church, right? We don't want to get our little old ladies sick from COVID-19, okay? And I'm just going to talk real briefly with the new loss of taste and smell, okay? There are studies that have shown that that is the most common symptom for people who develop COVID-19, so more than fever or cough. And that at least in one study, they showed that 12% of people, that was their very first symptom. So if you develop that new loss of taste or smell, you need to stay home. You need to get tested, okay? And then nausea, vomiting, and diarrhea. So that's another symptom that happens early on. And if we can recognize that as being part of COVID-19 and stay home, then potentially we can keep from spreading COVID-19 as much, okay? So it's important that we go ahead and we self-monitor for those symptoms, for any of those symptoms. If we get it, we need to stay home. If you've been around somebody who's sick who has those symptoms, we need to stay home, okay? And we also ask that you go ahead and check your temperature prior to coming in to work at church. And if you have a temperature greater than 100, then you should stay home. What do you do if you develop these symptoms? First off is you need to stay home. Second thing is you need to contact your healthcare provider. And don't just show up at their office, give a call. We want them to be aware so that they can keep you out of the waiting room and potentially from spreading it. The other option is you could potentially get tested through OptumServe, okay? And this is the link to do it. It's a free way of getting tested so that they will take your insurance information, but my understanding is they will not bill you. They'll bill your insurance company, and what your insurance company does not pay, then they won't come charging you. So this is a good way of going ahead and getting tested. If you should develop severe symptoms, so persistent pain or pressure in the chest, confusion, blue lips, or face, or unable to catch your breath, those are reasons to go into the hospital and go into the emergency room and get checked out. What if somebody tests positive for COVID-19? And I think that this is important because I think as clergy, the temptation is we want to go and pray over people and to try and give them comfort. And with COVID-19, What you're doing when you do that is you put everybody else in your congregation potentially at risk. Okay, and so, trying to do it with FaceTime, with doing it by the phone, whatever you can do to try and meet those needs without physically being there is a good thing. This is when we say that people are no longer infectious. So if it's been more than 72 hours since they had a fever, if their symptoms have improved, so cough and shortness of breath have improved, and there's been more than 10 days since there's been symptoms. And so these are ands with that. So they have to meet all of those criteria before we go ahead and we say that they're no longer infectious. Okay? Social distancing. We've kind of talked about this a bunch already, but staying 6 feet apart really makes a difference for decreasing the spread of COVID-19. And that's not just true at church, that's out in the community. So when we're hanging out with a large group of people and we're in that less than 6 feet for more than 15 minutes, we're putting our church family at risk by doing that. And so we really want to try and limit that as much as we can. Cloth masks and face coverings. So first off, I just want to say that they don't protect the wearer who's wearing it nearly as much as everybody else around them. That's what really those masks do, is they keep those particles from going out. And so for Christian churches, in some ways, it's almost like a Christ-like thing to do, is to be willing to put the mask on, even though it might be hot, even though it might be uncomfortable, for somebody else, for our little old ladies who are at risk for COVID-19, okay? It does not replace physical distancing, okay? We've got such fantastic evidence between the physical distancing and the masks, it helps, but that distancing we know really works, okay? And they need to cover both the mouth and the nose, and we need to clean our hands after we touch the outside. So we don't want a particle to get on the outside of the mask or us to touch it and then touch our eyes and it becomes sick. So if you go ahead and you touch the outside, we need to use a little hand sanitizer or wash our hands. And we need to avoid touching our eyes, our nose, and our mouth. And we need to go ahead and wash those frequently. As far as for hand washing, we say that COVID-19 is pretty easily washed down the drain with a little bit of soap and water for 20 seconds. Hand sanitizer, need to make sure that it's got at least an ethanol level of 60% or isopropyl level of 70%. And that is highly effective in negating the coronavirus. Here are some links for if you are employed by the church and you end up having sickness or other things go on, and this is available through CDPH if you go to the worship services, and you can go ahead and get the information you need for that. In summary, COVID-19 symptoms vary from absolutely none to life-threatening. Older individuals and those with more health problems are at increased risk. And those are the ones that we really want to take care of with implementing these things. We want to protect our elderly. And it's important to recognize our symptoms and to stay home if we develop the symptoms of COVID-19 and to get tested so we keep from spreading it. Respiratory droplets are the primary mode of transmission. And there's three things that we're really going to do to try and decrease that. And that's going to be using that more than 6 feet, using masks so that those particles don't go out as much, and to avoid singing so those particles don't go out as much. Thank you. I hope that this was helpful. Have a good day.